Okay. We got Congresswoman. All right, are we ready, everybody? Okay, yes, I know, we're melting. All right, good morning, everyone. I'm Katie Schubert. I am President and CEO of the Society for Women's Health Research. And for those of you who do not know us, we were founded in 1990 to address the women's health gap, which is why we're all here today. And this was a time when women were not routinely included in clinical research, nor were sex differences accounted for. And today we continue to advance women's health through science, policy, and education. While so much progress has been made in women's health research since our founding, there's still a lot more that needs to be done, and that's why we're here today. It's been more than 30 years since the NIH Revitalization Act, and nearly the same amount of time since the creation of the Offices of Women's Health across HHS. These were very hard-earned accomplishments achieved by years' worth of advocacy, coalition building, and bipartisan consensus to finally center women in our approaches to public health and medical research. With great thanks to those who were doing this work then. Phyllis Greenberger is here, former head of SWHR, Dr. Pinn, who you'll hear from in a minute. But we are here standing on your shoulders to take this thing to the final stages. Let's close this women's health gap. All of the changes that have been made up until this point were very meaningful and very necessary. But the vision to center women and investigate sex differences, it still requires a lot of effort. I'm going to quickly illustrate for you. Also, thank you. I know we are melting here and we appreciate you. I'm going to give you a few stats here. More than 2/3 of Alzheimer's disease patients are women. Women account for the majority of autoimmune disease patients. Uterine fibroids affects more than 26 million women, but it takes an average of 4 years to diagnose it. Women are 52% more likely to suffer adverse side effects from standard drug dosages. And women spend 25% more of their lives in poor health than men. And I could go on. This is the reality of women's health. That reality is sobering, and even more importantly, it's entirely avoidable. Not only is it avoidable, but it's an asset to our nation to make investments in the health of women, which could add $1 trillion to the global economy. So today, just 11 days following our nation's 250th birthday, we stand with our trusted partners from the American College of Obstetricians and Gynecologists and the Women First Research Coalition to share for the first time ever the national strategy to close the women's health gap. We're proud to be joined by well over 30 national organizations. Thank you all for answering the call and saying yes. And together we are calling on Congress to invest $20 billion over the course of the next 10 years in women's health. And you did hear that right, that was $20 billion with a B over 10 years. This is a bold, sustained investment across research, regulatory oversight, workforce, data, and education to close the women's health gap once and for all. This is the women's health moonshot. This, we believe, is absolutely achievable. We're calling on these investments for coordination of agencies, improved drug approval pathways, the clinical workforce, public education. You can read the full strategy on any of the QR codes. Thank you to our models. You can go to the website at swhr.org/national strategy. We've seen what's possible when we put our minds together and we commit to solving big challenges. Think about what we've done in areas like breast cancer, HIV, cancer prevention through the HPV vaccine. These breakthroughs did not happen by accident. They happened because we intentionally invested, prioritized, and quite frankly, refused to accept the status quo. So now it's time to bring that level of accountability and commitment to women's health broadly. The reality is we're all tired, right? We are tired of going to the doctor's office and being told that our pain is not real, that there's simply no explanation for what it is that we're experiencing. Much less is there a treatment or a cure for it. For too long, we've all accepted these gaps as inevitable, and they are not, and they are the result of choices, and Congress can choose to make different choices. The national strategy is about far more than conditions that affect only women. It's about looking at this issue from a public health perspective, from an economic perspective. It is a family issue. It's an American competitive advantage issue. And so standing here today, I'm really encouraged by the outpour of support that we've all had. So proud of this coalition and the team for pulling this together when we all sort of initially talked about this not that long ago. The tide is turning. Now it's time for Congress to turn that commitment into action. So thank you to ACOG and WFRC for being our fearless partners in this endeavor, for the architects of this national strategy. Thank you to all of the organizations who have joined us in endorsing the strategy. Thank you to members of Congress who are already helping make this vision a reality. And I want to acknowledge and thank those who've been at the helm of this charge for decades. I mentioned Phyllis Greenberger, Dr. Pinn, the women who came together over 30 years ago to get the NIH Revitalization Act passed, to include women in research, to stand up offices of women's health. We're here today to continue that vision and that legacy to make this change happen. So, with that said, I know it's hot. I'm so sorry, guys. It's my pleasure to introduce the Honorable Congresswoman Rosa DeLauro, who represents Connecticut's 3rd District. She's ranking member of the House Appropriations Committee and a leader and a legend in advancing women's health in Congress. We're honored to have you with us today, Congresswoman.
Thank you so much. Thank you. Thank you so much. What an auspicious occasion, and the folks who are here are real pioneers. And when I see Dr. Pinn and I see Phyllis Greenberger, I am reminded over and over again of the work that was done, the vision, the pioneers who have made a difference, such a big difference in women's lives and women's health, and saving women's lives in this country. Just a moment, you know, my own story is one that in 1986 I was diagnosed with ovarian cancer. You know, through the grace of God and biomedical research, I survived ovarian cancer. I didn't have any epiphany, but I knew at that time, while I was Chief of Staff for Senator Dodd, that I probably needed to go on to try to do something else, because cancer patients and people who survive want to try to give back in some way. And so I left and went on to do some things, and then the position in the 3rd Congressional District opened up, and I ran for office, and I was elected. And where did I want to go? I wanted to first go to the Energy and Commerce Committee, because that's where they were dealing with women's health. I was committed to trying to do something about women's health because of my own experience. I didn't get to Energy and Commerce, but I did get to the Appropriations Committee. And for me, this is where this all happens, and where we can really make a difference for women's health and provide the funding that's necessary, the investment, so that women and their health will be acknowledged. I was there when we fought to have women as part of the clinical trials at the NIH. As both Phyllis and Dr. Pinn know, we made that fight. And that was a bipartisan effort, I want to tell you. Myself and Nancy Johnson in Connecticut and Barbara Kennelly, but Marge Raukema and others we came together and said women have to be focused on. I would also like to mention another milestone, which was the Affordable Care Act. That was one of the first times that women's health was acknowledged, and we were going to do something about it. But for so many years, and still today, women's health is a back burner to the health of men in this country, and that has got to continue to stop. So I am so proud to stand with such stalwart advocates, experts who span a multiple of disciplines, but are united by our common purpose to close the women's health gap. The proposal put forward by the organizations assembled here, including the Society for Women's Health Research, I spoke at that dinner so many times. I really got, right, Phyllis, Lordy. The American College of Obstetricians and Gynecologists, the Women First Research Coalition, and Women's Health Alliance. This is charting a new course, my friend. This is about eliminating that gap through smart, targeted investments in key federal programs. I am so impressed with what your proposal is, which deals with research and innovation, talks about modernizing in so many ways. It talks about increasing the workforce and making sure that they have the training that they need. It talks about building on data and science. This last piece, I believe, is so critical. There needs to be the continued public awareness and education of women, that we can stand up and fight to make sure that our health is safeguarded. In Congress, as you know, I serve as the ranking member, the House Appropriations Committee and the subcommittee which oversees the funding for the Department of Health and Human Services. And we're going to win again, my friends, in November, and we're going to take it back, and it's my intention to chair that Appropriations Committee and look to restore the funds that have been cut back, particularly in the areas that fund women's health services and what's going on at the NIH. Earlier this year, we successfully negotiated a bipartisan bill which would provide $116 billion to the Department of Health and Human Services, and that would increase funding for the NIH by $400 million, and boosting resources for the Office of Research on Women's Health by nearly $30 million, a 40% increase. And we did so with a Republican majority in the House, in the Senate, and a Republican in the White House, because research has shown that around the world, around the globe, closing the women's health gap could generate more than $1 trillion in economic growth by 2040. Conversely, failing to close that gap would cost the United States hundreds of billions of dollars in lost growth annually. Beyond the economic impacts, my friends, this is a moral imperative to address what is a persistent problem. We have an obligation to succeeding generations to lay the groundwork for new breakthrough treatments and radically change the way women live their lives today. It's incumbent upon all of us in this institution, all of us who are involved in this work. We need to use our influence, our authority to expand access to care, uplift the voices of those who have been left behind. I'm grateful, so grateful, to be here today and joined by organizations and leaders across the health ecosystem. And it's a bold framework, but you need to be bold. You know, what our leader says, Hakeem Jeffrey, let's be bold, transformable, and let's do what is achievable. This is achievable. A whole government approach with the potential of dramatically shifting the women's health research landscape. Much work to be done. The proposal before us is an important step down that path. I cannot thank you enough for allowing me to be here today and join forces with you. We're on the move. We're going to get it done together. That is our goal. We may not do it in the next few months, but come next year, we're going to do it. Thank you. Thank you.
Thank you for your leadership.
Any questions? We have
Oh,
a couple minutes for you. Any
yes.
questions
Any
for the
questions?
Congresswoman?
Go ahead. Yes. Tell me who you're with. No. You know, it's not going to be passed in that direction. And let me be very clear with you. I do not support reconciliation. Reconciliation is another way to get around the appropriations process where this appropriately belongs in terms of appropriating the funding for it. But if we can repeal the big, beautiful bill and other things, we have the money to be able to do this. That package is a package that is going to primarily, this new package is $80 billion for defense. We're not going to add, it won't get added to this. We would be unable to do it. Well, we're going to move forward, as I said, you know, we're in an environment today that cuts off opportunities for these kinds of efforts. And we wouldn't get the agreement to move forward. So my point is that we are going to, we will take this place back in January. We will look to an appropriations process, and we will look to repealing something like this big, beautiful bill with the dollars that it has, and make our focus closing the women's health gap. We'll find the money within the appropriations bill to do these things, rather than through a reconciliation package, which thwarts, which is what the administration is all about, is thwarting the power of the purse, and is constitutionally cited that belongs to the Congress. We have the power of the purse. That is the way through getting what we need to get done. Thank you. Any other questions? Okay, thank you.
Oh my gosh, thank you. Just delighted, and absolutely, this is a package that the broad community can rally behind and lift up in our appropriation strategies, in our other legislative and policy strategies, comprehensively, right? We want a rising tide lifts all boats, but also this is truly about integrating and prioritizing women's health across the federal agencies. So now it is my pleasure to introduce and pass the mic to Dr. Sandra E. Brooks. Dr. Brooks is a gynecologic oncologist and the Chief Executive Officer of the American College of Obstetricians and Gynecologists.
Good morning, everybody. And before I start, if you're standing straight up, bend your knees a little bit. It's hot out here. We don't want anybody falling over. Good morning, and thank you for being here, and thanking Ranking Member DeLauro for your support and continued leadership in our efforts to close the women's health gap. Today is an important moment, not just for women's health, but for the health of our families, our communities, and our nation. And as CEO of American College of OBGYN, obstetricians and gynecologists, affectionately known as ACOG, and as a physician and gynecologic cancer doctor, I've spent my career caring for women across every stage of life, and I've seen firsthand the extraordinary progress that we've made in medicine, but I've also seen the consequences when research, innovation, and investment fail to keep pace with the health needs of our population. For far too long, women's health has been under-prioritized and under-resourced. Between 2013 and 23, just 8.8% of NIH grant funding was directed towards women's health research. As OBGYNs, we see the consequences of that every day in exam rooms as we counsel our patients. Women are frustrated, physicians are frustrated, and patients come to us seeking answers as conditions such as endometriosis, which was mentioned, menopause, chronic pelvic pain, and other health challenges that can profoundly affect quality of life are really too often. We have to tell our patients that science has not advanced as quickly as it should have. As clinicians, there's nothing more frustrating than sitting with a patient who is suffering and knowing that we do not yet have better answers, better treatments, or better options to offer. Those gaps in knowledge and options have created space for misinformation to flourish, and women increasingly turn to social media, influencers, and unproven treatments because they're desperate for information and relief. Too often, others profit from that uncertainty. When the research and evidence is lacking, misinformation fills that void. That gap is one reason why we cannot afford to wait any longer to address these gaps. The stakes are incredibly high, as you know. We must help women live healthier, fuller lives. We must accelerate innovation, improve prevention, and detect diseases, including cancer, earlier when we have the greatest opportunity to improve outcomes. We must ask ourselves, are we satisfied with the status quo when so many people are suffering? That is why ACOG is proud to stand alongside the Society for Women's Health Research and the Women's First Research Coalition and other partner organizations to launch the national strategy to close the women's health gap. A bold, coordinated vision for the future. This strategy, calling for $20 billion with a B, federal dollar investment over 10 years to strengthen women's health research, modernize regulatory pathways, build the workforce, improve data infrastructure, and increase public awareness and education. For our OBGYN members, the mission is clear: to improve the health of all women and to ensure access to high-quality, evidence-based care. We know that better research leads to better care. Better data leads to better decisions. Better support for our fields leads to stronger OBGYN workforce. And better investments in our future leads to healthier lives. But no single organization can achieve this alone. Closing the women's health gap will require us to think bigger than any one group of physicians or programs, institutions, or sectors. It will require a shared vision and sustained commitment from policymakers, researchers, clinicians, patients, advocates, and industry leaders. It will require us to come together as a community and speak with one voice about the value of investing in women's health. This should not be a niche issue. It should be a national priority. When women are healthier, families are stronger, communities thrive, and our economy benefits. Investing in women's health is investing in America's future. And with that, it is my distinct pleasure and honor to introduce a mentor of mine and a trailblazer for women's health, Dr. Vivian Penn. Dr. Penn was the inaugural director of the Office of Research on Women's Health at the NIH, leading the office for more than 2 decades. Thank you, Dr. Penn.
Thank you, Sandra. I'm not as decrepit as I look, but I'm happy to be here. And thank you, Sandra, for introducing me. But I can't go forward without first, again, acknowledging our Congresswoman, Rosa DeLauro. You're talking about investing in women's health and a strategic strategy to close the gaps in women's health. And we talk about the Office of Research on Women's Health when it was first set up in 1990 and moving forward in 1991. Remember, at first it was seen just as a policy office to set up policy for the inclusion of women, to move to a research agenda, to fund research projects, to fund career development for women and men in women's health research. That's because the Appropriations Committee provided resources to the NIH to fund our office. I remember the first year when we had nothing and we realized, Dr. Spong will remember that there was absolutely no research on uterine fibroids or endometriosis being funded by the NIH, as common as they were. I'm okay,
So
thank
sorry.
you. I'm okay.
Peanut gallery.
And we were then given $800,000 as our first appropriation. And working with NICHD, we funded some of the first research in that area. So I again want to say, let's give applause to Rosa DeLauro because she has meant so much over the years for our office and progress on women's health. And so I can firmly support the plea here today for all of us to invest in this strategy, to call on Congress to recognize the importance of women's health for women's health research forward. Now, I remember when the office was first set up and we talked about women's health. We had to explain what women's health was to so many people. They'd say, what is women's health? Why is it important? I don't have to reiterate that today. We all know that. And while we've had 30 years worth of research and efforts, and I'm proud of what we accomplished, we know that every time we make an advancement in science, new gaps in knowledge open up. And we cannot let this fall behind. It is so important that we continue to dwell and to bring about that excitement we had, to keep that excitement going about funding women's health, recognizing what it is, and moving forward. So I'm proud to stand here today with the Society for Women's Health Research that has been a partner since the very beginning, helping us with the clinical trials, helping us with the Congress. ACOG and Dr. Brooks, wonderful that you're there, and the Women's First Research Coalition, as well as over 30 organizations that are collaborating as this. Yes, I was the inaugural director of that Office of Research on Women's Health. It was interesting. It was a challenge. I went into a job. There was no real job description because nobody had done it before. And there were many who said, we're wasting money. This is just to be politically correct. And so from the beginning, we had to show that everything we did was based in science, were science-driven initiatives, and that we were really pursuing science, and that has continued. So I'm so proud of what we invested in and what we did, but it also hurts that we've got so many gaps that are still here and to still hear about issues related to women's health. So this is a critical moment. We need to make a transformational investment and continue this movement. Finally close many more of the gaps related to women's health so that we can make the changes and provide the information that women deserve and that they and their health care providers need and that public health officials need in constructing health policies. We want to close that gap from 40 years ago and make sure that our children and grandchildren will be talking about what happened in 2026 to make a difference for the future. Thank you so much for including me.
Thank you, Dr. Penn. Okay. All right. Thank you, Dr. Penn. I think there's so much to be proud of from the work that you all started. And we're all coming together to really move that needle forward even more. And I'm now happy to introduce Dr. Kathy Spong, someone who has a true understanding of why these investments are so important. She's a maternal fetal medicine specialist, a physician scientist. She had a 23-year career at the NICHD and the NIH, where she served in many different leadership capacities. She's a member of the SWHR board, and I feel like I've been working with you for a very long time. So thank you for being here.
Thank you so much. What an honor for me to be here today, seeing so many people, Representative DeLauro, Dr. Pinn, Dr. Greenberger, Florence Hazeltine, who's not here today but is with us in spirit as she is in London with her grandchildren, which is wonderful. Oh, yes. I care for pregnant women, often facing serious medical complications, and like every physician, I want the best possible treatment for my patients. Unfortunately, the evidence simply isn't there, often because there is no research. These experiences have stayed with me throughout my career and reinforce that research is not abstract. It changes clinical decisions. It creates the evidence for practice. It improves outcomes and gives patients and families hope. I'm Dr. Catherine Spong. I'm an obstetrician gynecologist and maternal fetal medicine specialist. I spent more than 2 decades at the National Institute of Child Health and Human Development, where I ultimately served as deputy director. I also had the privilege of chairing the Department of Health and Human Services Task Force on research specific to pregnant women and lactating women. And I am proud to serve on the board of directors for the Society for Women's Health Research. Throughout my career, and I have a unique career being in the government for so long and now being in academic medicine, that I have seen what happens when we invest in science. My career has centered on creating the evidence for practice. I have seen and been part of federal research that has transformed the care that I provide to women and their families. It has reduced maternal and infant complications, advanced treatments for diseases that affect women, and given patients hope where none previously existed. But we also know that there is so much more to do. Too many conditions that affect women remain incompletely understood, and too many clinical decisions are still made without the evidence that women deserve. For me, this comes down to one simple principle. Better evidence leads to better care. That includes women, pregnancy, and lactation, where women too often have been left without evidence needed to guide their care. That is why today's national strategy is so important. It provides a roadmap for strengthening research, supporting the next generation of investigators, modernizing our research infrastructure, and accelerating the translation of discoveries into better care. Improving women's health is simply not a women's issue. It strengthens families, communities, and our nation's health. I hope Congress will seize this opportunity to make a sustained, bipartisan investment in women's health research. The discoveries we will make today will improve the lives of women and generations to come. On a personal note, I have 3 daughters. I want evidence to guide how they are cared for. Thank you so much.
Dr. Spong, it was Florence Hazeltine, because we used to take the plane together to fly. She guided me on a journey and where I should go, and that I needed a gynecological cancer. She is my best. Oh, God, when you talk to her, give her my love. Every day. Thank you.
Oh my gosh, thank you for that. Thank you, Kathy. It is now my pleasure, and I want to also acknowledge, thank you everybody for standing here in the heat. We picked the hottest day of the year for us, but our colleagues at the National Health Council and Healthy Women, the Endocrine Society, Us Against Alzheimer's, I'm going to miss everybody. Please go to the list and find that list of over 30 supporters and growing so that you can see the vision of this call to action. It's now my pleasure to introduce and pass the mic over to our final, last but not least in any respect, speaker, Erica Miller of the Women First Research Coalition, which has 16 leading advocacy organization medical subspecialty societies who are working to advance women's health research. WFRC, having been in the room the moment that it was created, alongside some other folks who are here today, have worked to increase federal appropriations for sustained investment in biomedical research, strengthen the women's health research enterprise, and accelerate those scientific discoveries we've heard so much about. So, Erica, I will turn it over to you.
Thanks, Katie. And I recognize that I am the person standing between all of you and air conditioning. So I promise that I will be quick. Katie told you a little bit about the Women's First Research Coalition, but I want to share a little bit with you about our founding. Our coalition launched in 2019 after Dr. Laurel Rice, then the president of the American Gynecological and Obstetrical Society, met with then NICHD director Dr. Diana Bianchi. Dr. Bianchi challenged the community to speak with one voice advocating for greater federal investment in women's health research. And then the Women's First Research Coalition was born from that conversation. I don't know if anyone here knows Dr. Rice. I feel like you do. But she is a force of nature, and we are here today because of her as an organization. Since then, WFRC has had the privilege of helping to secure meaningful progress from establishing NIH's new RCDC for menopause. Before, NIH had no way to track research on menopause, despite it occurring to every woman who is lucky enough to reach midlife. We have been able to increase funding for the Building Interdisciplinary Research Careers and Women's Health program. Big thanks to Representative DeLauro for that. That program is key to building the workforce needed for women's health research. We also secured the funding and the report language that led to the National Academy study on women's health. And that was the study that finally gave us a comprehensive assessment of NIH's investment in women's health across the lifespan. And we know it is not up to par. But our story didn't begin in 2019, and long before Dr. Rice started WFRC, Congresswoman DeLauro was championing women's health research in Congress. Dr. Pinn was leading at NIH. Dr. Greenberger was leading as well. They and so many others made today's conversation possible. We are deeply honored to have so many of them with us today and thank them for their extraordinary leadership. But today's launch is not the culmination of the work. It is the beginning of the next chapter of the Women's Health Moonshot. The national strategy to close the women's health gap is more than a bold vision. It is a framework for making women's health a national priority through sustained investments in research, workforce development, data infrastructure, public awareness, and ultimately better care. It outlines a bold but achievable goal, a $20 billion investment over 10 years to build the evidence infrastructure and workforce needed to finally close the women's health gap. I've worked in Washington for a long time now. $20 billion sounds like a lot of money, but when we're talking about $20 billion over 10 years, that's really just a modest investment to doing what's right. The strategy also reflects our core belief that brought WFRC together, that when organizations unite around a common vision, we can achieve far more together than we ever could individually. Today, that coalition has grown to include everyone here, and we are honored to be joined by 37 organizations who have endorsed the strategy. We hope that that number continues to grow. All of you tell your friends and colleagues. And our work now shifts from developing this framework to making it a reality. We look forward to working together with Congress, the administration, researchers, clinicians, patients, and advocates to turn these recommendations into policy and sustained investment. Because investing in women's health is more than good health policy, it is good science, it is good economic policy, and it is an investment in America's future. I also want to thank our partners at SWHR and ACOG for their extraordinary collaboration in developing this strategy, and to all the organizations represented here today. Thank you for lending your voices and your commitment to this effort. If it weren't about 100 degrees outside, I would recognize all 37 endorsing organizations by name. Instead, I'm just going to say again, thank you for standing with us. To learn more about the strategy, you can scan the QR codes on any of these signs, or you can visit swhr.org/national strategy. Thank you all for being here today. Thank you for your partnership, and thank you for helping us to working to close the women's health gap for good. Sorry guys, I'm like.
Thank you all. Thank you. Oh my gosh. Thank you. Oh my gosh. I was like, I'm melting.
Great to see you.